This is why a lot of people, when they go plant-based, many of them talk about, and we see this a lot anecdotally, they feel so much better in that first 6 months, even possibly to a year, and then they get a year plus in, and then their health starts to deteriorate, their energy starts to decline, anxiety is a common side effect here. It's because they're tapping the liver storage out. And once that happens, you've got big problems, because B12 deficiency is a pretty onerous ordeal. I mean, it can really do a number on your health. Now let's talk about a couple of factors that can interfere with these mechanisms that we were just talking about. So number one, and that's actually not on this list, I think I'll come back to this other slide real quick. It's right here, your salivary glands. There's a particular autoimmune disease called Sjogren's. And Sjogren's disease is where there's an autoimmune reaction against these glands, and so your production of saliva is dramatically reduced. And in that process, that can potentiate or lead to haptocorrin deficiency, which is going to interfere with vitamin B12 absorption. So if you do have Sjogren's, you want to keep that in mind. You should be having your doctor measure your vitamin B12 levels on a regular basis, because you're at much greater risk for developing a deficiency. Now, there's some other things you can see here that can interfere. A lot of these interfere with intrinsic factor. IF is intrinsic factor, that substance that helps carry vitamin B12 all the way through your intestine for it to be absorbed. And so one of those things is a surgical procedure called a gastric bypass. So if you've had a gastric bypass in your life, understand and know that you have limited your intrinsic factor production and are at great risk for vitamin B12 deficiency. I used to teach a class on malabsorption post gastric bypass to GI doctors, and even to date, after teaching, I still very rarely see GI doctors measuring vitamin B12 post gastric bypass. So if you've got this problem, you definitely want to monitor your B12. I mentioned before the H. pylori, the infection H. pylori. Helicobacter pylori can also reduce intrinsic factor, and so can contribute to vitamin B12 deficiency. If you've had an ileal resection, you're at greater risk for reduction of absorption of B12, because this is the area where B12 is absorbed.